This is a presentation on the flu of 1918 by Nancy Makori, Wilson Community College, Biology 275, Microbiology by Leslie Harrell. Introduction. The 1918 flu virus is also known as the Spanish flu. It was an H1N1 subtype of the influenza A virus. It caused a devastating pandemic in 1918 to 1920. The exact origin of the virus is unknown. It was first documented in Kansas in March 1918, and it quickly spread through Western Europe and the world, first in ports and then along transportation routes. Characteristics. The influenza A virus is a member of the Orthomyxoviridae family of viruses. It's enveloped and has a segmented negative sense single-stranded RNA genome. The genome is divided into 8 regions that encode 11 different proteins, which are responsible for viral attachment, replication, and pathogenesis in the host. The two most abundant proteins on the surface of the influenza A virus are hemagglutinin HA and neuraminidase NA. The HA spikes are rod-shaped, while the NA spikes are mushroom-shaped. The size of the virus is 80 to 120 nanometers in diameter. Virus types. The influenza virus has 3 viruses, influenza A, B, and C, and are classified according to antigenic differences in the nucleoprotein NP and matrix protein M1, which are major structural components of the variants. Of the 3 members, influenza A viruses cause annual epidemics in humans and recurring pandemics that spread globally with severe consequences for human health and the economy. Historical facts. People call the influenza that caused the 1918 pandemic the Spanish flu because they mistakenly thought it started in Spain. Though the first cases were thought to have been in the US, Spain was just the first country to start talking about it publicly. The World Health Organization (WHO) recommends avoiding using geographic terms in names for illnesses. In this case, the term Spanish flu could be seen as blaming a particular country for an illness and creating a stigma. History of the 1918 flu pandemic. The 1918 influenza pandemic was the most severe pandemic in recent history. Mortality was high in people younger than 5 years old, 20 to 40 years old, and 65 years and older. The high mortality in healthy people was a unique feature of this pandemic. In 1918, the cause of human influenza and its links to avian and swine influenza were unknown. Despite clinical and epidemiologic similarities to influenza pandemics of 1889, 1847, and even earlier, many questioned whether such an explosively fatal disease could be influenza at all. That question did not begin to be resolved until the 1930s, when closely related influenza viruses, now known as H1N1 viruses, were isolated, first from pigs and then shortly thereafter from humans. The most recent history of the 1918 pandemic. In 1930, Shope isolates influenza A virus from swine. In 1951, Huntley attempts to isolate the 1918 virus in Alaska. In 2005, the 1918 virus is reconstructed. Currently, scientists are exploring the prospect of developing a universal vaccine by exploiting T cells and by attempting to elicit broadly neutralizing antibodies. The signs and symptoms of the 1918 flu. Many flu symptoms that people experienced in 1918 was similar to what we experience with seasonal flu now, but many cases were more severe then. Symptoms included a sudden and sometimes very high fever, dry cough, headache and body aches, shortness of breath, sore throat, chills, runny nose, loss of appetite, extreme weakness, extreme fatigue, blue skin, lips and nails, pulmonary edema, internal bleeding. Pathophysiology. Infects cells. The influenza A virus enters the body through the respiratory tract and attaches to epithelial cells. The virus then uses the cell's machinery to replicate itself, which kills the cell and releases copies of the virus to infect other cells. Triggers inflammation. The body's immune system responds to the infection by sending antibodies to fight it, which causes inflammation. This inflammation can spread throughout the body and lead to multi-organ failure. Causes cell death. The influenza A virus, AIAV, can cause cell death through apoptosis, necroptosis, and possibly pyroptosis. The type of cell death and its outcome depends on the cell type and the viral strain. Diagnosis of the influenza A virus. In a laboratory, influenza A is typically identified using a molecular test called reverse transcription polymerase chain reaction, or the RT-PCR, which detects the influenza A virus's genetic material RNA in a respiratory sample like a nasal swab, providing a highly sensitive and specific method for diagnosis. Some rapid influenza diagnostic tests, RIDTs, can also identify influenza A antigens, but they may have lower sensitivity compared to RT-PCR. Types of flu tests available include molecular tests. These tests look for genetic material from the flu virus. Polymerase chain reaction tests, shortened as to PCR tests, are molecular tests. You also may hear this type of test called a NAAT test, short for nucleic acid amplification test. Another type of test is the antigen test. These tests look for viral proteins called antigens. Rapid influenza diagnostic tests are one example of an antigen test. Treatment of the flu. An antiviral medicine is used to treat the flu if you have a severe infection or are at high risk of complications from a flu infection. These medicines can include oseltamivir or Tamiflu, paloxavir or Sofluza, and sanamivir or Relenza. Oseltamivir and paloxavir are taken by mouth. You inhale sanamivir using a device similar to an asthma inhaler. Sanamivir shouldn't be used by anyone with certain chronic respiratory problems such as asthma and lung disease. People who are in the hospital may be prescribed peramivir or rapivab, which is given in a vein. These medicines may shorten your illness by a day or so and help prevent serious complications. Some interesting facts of the 1918 flu. Thousands of patients reported the classic symptoms of influenza. However, this strain struck more severely and soon some patients turned blue at their fingers, arms, or face, had trouble breathing, and even bled. More shocking was these were young men and women suffering from these terrible symptoms. Doctors had few resources and few medicines to assist at the time. Nurses could help. Nursing care was critical in the day-to-day battle against influenza. Nurses were overwhelmed with numbers of patients either at the hospital, at home, or in the field, yet they continued to do their job in the face of overwhelming numbers. The properties of the virus that made it so devastating are not well understood. With no vaccine to protect against influenza infection and no antibodies to treat secondary bacterial infections that can be associated with influenza infections, control efforts worldwide were limited to non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, and limitations of public gatherings. And these are the references. Thank you for listening to my presentation.